Ready? Okay. Hello, everyone. It's Susie Kwok again, sharing strong bones and pain-free. I really, well, okay, bones and teeth. You know, bones actually, teeth, because I can tell you my story. I'm very interested in how to build strong bones like 40 years ago, okay? And today I can tell you, I still have all my teeth, okay? And 40 years ago, my dentist already told me, you're gonna lose a lot of bones. You lost 40% bone density after my second son's birth. I lost. So my teeth were just kind of like moving. They're good teeth, but they're just gonna fall out, you know? And so because the bones that are supporting my tooth, they just receded. I got all kinds of gum infection. So I can tell you what, after some 34 years, I am very healthy. And I can tell you, I witnessed some of my friends at age 50, denture. They had to wear denture, okay? So bones and teeth are the same. Now, what's the trend? Last year, there was a magazine say, it is estimated that by 2030, which is only 10 years from now, the amount of hip replacement procedure performed from age 45 to 54 will grow 17 times. This is scary. Okay, not even talking about people that are 60, 70, 80 years old. Okay, so all I can tell you, I'm just so happy that I found Ring products 10 years ago. Strong bones. I can carry, drag my luggage. I mean, I can go everywhere. And my teeth is stronger than 40 years ago. Now, again, omega-6 deficiency can lead to arthritis, wounds that aren't easy to get healed, okay? Internal tissues, especially in the mouth area or your joints, you got to understand internal. You know, if you hurt you burn your skin, you can heal very fast. Anything inside, the cells inside, it takes longer time, okay? So, of course, you know, I always want to refer to viral infection because this is the big topic now globally. So, better condition for body when we have sufficient omega-6 and cold press, okay? I wish you have some friends that are studying nutrition or they, you know, young graduates, or maybe they just working in private industry, share with them. Because honestly, some of these people just keep talking out there, say we have taken too much omega-6 and that's why it causes inflammation. And correct or non-correct is because whether it's a bad oil or it's a good oil, okay? Now, this is a picture about any joint is the same thing. Even our spinal cord, when you mention bones, okay? And the cartilage worn out, okay, get thin out. And it's because of chronic inflammation and that causes the healing not heal up totally. And therefore, the cartilage just gets thinner and thinner and thinner. And it is really sad, okay? If we don't pay attention to good nutrition, the far right bone, you see, when the time the cartilage no more, you talk about bone hitting bones. And what you gonna do? Take pain pills all the rest of your life, or just stop walking, right? Or stop moving your hand. I tell you what, it's a process. Everything takes time. The degeneration takes time. And same thing as regeneration too. Okay, so when you start on Rainsoul, I mean, start on this fascinating product, got certified anti-inflammation, and has all the nutrients to rebuild your tissues. It takes time too. Now, so that's why whenever I have customers ask me, I have this pain, I'm on medication, I'm rheumatoid arthritis, or I'm born with it, my family history have it. I tell you what, you just have to say what condition you think you are in. Okay, this is a fact. So if someone just on the left side, just beginning inflammation, they just started it, that's easy. It takes 3 packets, probably already gone. 1 day, 2 days, 3 days. But if it's something on the right, it's going to take some time, okay? Yeah, so that's why I like to use pictures so you can visualize what kind of condition you're in. And no one can help you, only you can help yourself, okay? And of course, you know, you're serious, you have to go see doctor, okay? But this is a whole co-best, whole seed nutrition. You know, when I started in studying nutrition, because I tell you, I used to buy a lot of vitamin pills. This is like 40 years ago. And especially I witnessed my friend, she would take these calcium pills this big, okay, very big, and prescribed by the doctor. She's a lady that took it for 10 years, and at age 50, all her teeth fell out. She wore denture at age 50. Okay, because she well, I mean, her job is very troublesome too, you know, so she called it work injury. But honestly, if you just depend on something synthetic, try to help you. And in the nutrition class, the professor said, in order to absorb, for your body to absorb that calcium pill, you need to have oil. You never take those calcium pill empty stomach. You got to take it with the meal. So there got to be oil in it, and there got to have protein in it, and there got to be level of sodium in it in order to absorb those calcium. Okay, so now if you imagine that picture I told you about the stages of your joints, if so happen your spinal cord, you know, all the disc hit this, it's going to be more than just pain. It's going to have an impact to your internal organs. Okay, so it's very, very interesting. You know, so you think you have some kind of stomach problem, indigestion, or whatnot. Okay, if it's something happen in your spinal, the discs, all I can tell you, you just have to be careful. Okay, taking that painkiller to reduce the pain so you can go to work is not the cure. Your further complication is when all your internal organ that are affected by the spinal cord, the nerve, is going to degenerate. My husband's a classic. He almost had to need to go to a back surgery. This is like 40 years ago. He injured himself. It's called hernia disc. Hernia disc is like this over this and dislocated a little bit. Okay, you know, when you carry heavy stuff, you have to have a good posture. Okay, don't take shortcut. You know, people just bend down, pick up a piece of leather, and they twist it. Okay, so I tell people, I said, don't you know, all the cartilage is like a rubber band, elastic, flexible. And if you don't have good lubricant, oil, you know, rubber band is petroleum oil, rubber made. And you pour enough, you let it dry up, this rubber band will break. Same thing with your tendons, your cartilage, everything. So when it's dried up, you just bend down, pick up a leather. You already hit it. Okay, you already twist it. And that's why I tell you what, it is so important in nutrition. I mean, I know I come through all those things. I saw my husband, you know, his 2 sisters would carry his 2 hands and 2 legs and put him on a station wagon, lay flat, and he has to go to get acupuncture. It went on 3 months. And then the doctor finally, he cannot even walk, my husband, because it was hitting on the nerve. And so the nerve would start feeding that kneecap. So he couldn't even walk. End up bad sciatic nerve. But I'm telling you, this is wonderful. So these are all our personal experiences. Also, my husband refused to go to hospital, no surgery. Then they said, how about just give you a shot, the steroid medicine shot. I said, no, don't do it. So we completely went natural. My husband fully recovered after about 3 months. And inflammation, you see, inflammation causes everything but arthritis, okay? Or joint pains, or any pain. Now, I want to share more on prevention approach, okay? Now, this is a magazine that came out called Longevity. It's an anti-inflammatory diet. This is certified anti-inflammatory product. The only one. Yes, there are a lot of so-called calcium, other supplements in the market. Okay, of course, this is the only one product. And of course, now Rain has a Ben product, which is fascinating. Okay, and so anti-inflammatory diet curtails bone loss. Why? That's what I'm telling you. If you have a joint chronic inflammation, that inflammation will eat up those cartilage, will eat up those tissue. Those tissue, the connecting tissue that's supporting those joints will, worn out. That's it. So you need to take nutrition that will, curtails bone loss. That means stop the inflammation, your bones will rebuild. Our body has the ability to rebuild bones, increase calcium working inside. One time I was reading the article that was these astronauts, they fly up to the space. They stay there 1 month. You see, because they lost the gravity, and there's no gravity up in the space, okay? So they float around 1 month. They landed at the space ship center. This doctor would check his health. One thing, they hardly can walk. And they detect that after 1 month, the spaceship up there with no gravity, okay, they're just floating. They lost about 30% bone density. So diet, exercise, okay? Very important. Yeah. So now your bones, every tissues in your body will regenerate. The bones, your body builds a whole new skeleton in 3 months. Come on. So I really hope that, friends that are suffering, okay, try it. Feed yourself with some fascinating nutrition. This package has complete protein, complete mineral, calcium, omega. You can take it anytime on the go. It is fascinating. So this is it. I have, in my 10 years of sharing this product, I have talked to athletes. I've talked to a lot of people. It's just amazing result. And now, I always talk about brain because of essential fatty acid. Did you know your pituitary gland controls the growth hormone, controls the secretion of the growth hormone, 3 to 5 mg. If your brain is dry, you're eating bad oil so long, so far, in the past 40 years, okay, and if you're suffering all kinds of pain, I don't care what name it is, okay, your brain is 60% fatty tissue. They'll try to pick up the first nutrient that you put inside your stomach, Okay, all the nutrients go to the brain first. That's the step one. And then we'll go to the other parts of the tissues. So growth hormone controls healthy bones, muscle mass, and fat distribution. You can take all kinds of calcium pill. If you're not eating good oil, I don't know how much they will help you. Okay, and all I can tell you, you really need to do some more research. Okay. Now this is what's on the news nowadays. I mean, balanced cholesterol. I mean, I told you already, cholesterol is very important. In America now, all the doctors understand. Okay, don't eliminate it. You know how 40 years ago, 30 years ago, we go to the supermarket, buy things, and say, no cholesterol. So we consumer, hurry up, go buy that one. Okay, anything say cholesterol, we don't want to get it. We don't want to eat. Okay, so I'm telling you, cholesterol is very important in every cells of the body. You cannot function. And it makes the digestive gallbladder bile involved with digestion, fat absorption, and vitamin D, and plays a role in strengthening bones and teeth. And it's essential for overall good health. Yeah, this just came out not too long ago. 40 years ago, doctor told me I got low cholesterol, low. That's why I got so much problem. So just tell you what, when people say bad thing about cholesterol, please correct them. There's no such thing as good or bad now. You need cholesterol balance, balance. The saturated fat, the unsaturated fat, the good cholesterol, LDL, HDL, it's called balancing. The body knows how to balance it, okay? And this is the spinal, this is all the so-called cartilage, okay? You have to keep them lubricated. And I did not add that picture in. I was looking for it. The inside, this spinal, inside these purple stuff, so-called the soft tissue, is liquid. So how my husband got hernia is because this soft tissue got cracked. The inside liquid gel leach out. That's called hernia disc. It just, that hernia little extra gel start hitting the nerve. That's why my husband was so painful. He can't even walk across the street. So now, this is normal bones, okay? A lot of little holes. And this is called osteoporosis. Okay, thinning out. Why? Your body, actually your thyroid gland controls the bones, the calcium, excuse me. The thyroid gland controls the calcium go inside the bone and then controls that. See, these are all regeneration. Every day the bones rebuild. You saw that already. 3 months. The dead bone cells, they come out. They'll produce the new one, and then the dead one come out. Your thyroid gland do that controlling. So build bones in the bone's density structure. What builds bones? Your hormone levels. I already gave a talk on that, and you go and look at that video, okay? There's over 50 types of hormones, okay? Thyroid is a hormone. Estrogen, testosterone hormone. Insulin is a hormone. Many hormones, okay? So you have to have good nutrition. You have good nutrition, then you have good bones. Healthy diet. Regular exercise. course, some vitamin D, sunshine. Now, when I was taking my classes years ago, back then the professor just say, on average, in the whole year, if you go out 50 minutes of sun, stay on the sun 50 minutes for total of 90 days, you should have enough vitamin D. The sun nutrient vitamin D will go in through your skin and deposit in your liver. Okay, it's automatic. So if someone live in there are some country of no sun, they get very little sun. Those people are very not too healthy. Okay, so they are man-made sun lamp. I bought some before because I go to the office in the morning and then I stay in the office work all day, so I really don't get the sun. So I tell you what, this is what we need. Understand? You want to build your bones? I tell you what, I always tell people, if I tell you what to eat, what to do, I think it's easier for me to tell you, take 2-3 packs a day. Your bones will be much stronger. Because why? Everything's here. Cholesterol makes hormones. What makes cholesterol? Good essential fatty acid and good liver. Because the liver makes it. So this is it. This is so simple. You can build bone just doing the basic things. But how about bone loss? Bone loss, low, okay, low level, low, that's it, low hormone. Thyroid problem, overactive, underactive, same thing. Adrenal gland, this is what I want to talk to people. Okay, assume you're very healthy, your hormone perfect. Adrenal glands, that's stress and emotion. Did you know, if you're angry on someone, angry for a whole day, you already destroy a lot of calcium making in your bone. You know why? When you're so stressful or angry, your adrenal gland will pump. The glands will secrete something that is so acidic in your blood. I think one book I read, it say if you always this hot temper type, just it's like throwing an atomic bomb into your bloodstream. These adrenal gland secretion called adrenalins. Okay, so don't try to calm yourself down. Okay, otherwise, tell you what, because of the adrenaline pumping, all that acidic things into the adrenaline into your blood, so the blood is very acidic. Calcium is one of the alkaline things that your body naturally will, it's an automatic system. Your bones, your calciums in these bones will leach out, will hurry up, come out to the bloodstream, try to neutralize your blood. This is where they talk alkaline acidic. Blood, not water now. I know sometimes when people I hear about these people talking about alkaline water, I said, I don't listen. This is the blood. Now, in America, there's a hospital. They did an experiment. They took all these patients that, by the way, you know what? 60% of the population suffer pain. And in America, we have big problem now. People overdose on these painkillers. Okay, you take one pill, 24 hours, no pain. It's heavy drug. And so in the hospital, they took these, two groups, one control group and the other group, you know, they make comedy. They put them in the room, 1 hour, they do this comedy show. So all these people been in the hospital on pain pills, they laugh 1 hour. And the one thing they notice, they don't cry for pain pills. No need for pain pill during the hour. And then they measure the blood, their inflammation lower. You see, this is it. Your bones are affected by your emotion. Okay, stress affect your emotion. So next time when you try to get angry, tell yourself, I love my bone. I don't want the osteoporosis. Just smile. Okay, just smile off. I mean, you know, this is life. The more you know, the more you would understand how to balance your life. This is how 10 years ago, when I saw this product, essential fatty acid, the first group of people I want to approach is taking pain pills, because there's nothing the doctor can help you. All the doctor can give you is pain pills. You take them, good days, you're okay. Bad days, you have pain again. So it's a lifetime thing. So if you keep taking that for a while, I'm telling you, you're going to have joint pains everywhere. And how you going to do that? You're going to take more capsules? No. Learn, go to the internet, check out many things, but now I tell you a shortcut. Very simple to do. Be happy, okay? Try to eat several packs a day. When you really, you know, we sometimes stress is out of my control, you understand? You have to work overtime to finish your project. So you just take 2 packets, okay? So this is it. Your bones are constantly built and constantly destroyed. And it's depending on your management. So that's why sometimes people tell me how many packs I take. I said, it's up to you. But you really sincerely, you start out really painful, please take 2 packets. Or even add a pack of core. Or 1 core. Okay? I mean, I have a friend that had toothache. I mean, that's different types of pain, okay? Toothache, that's bacteria. She took 2 core. It was midnight, happened 11 p.m. No dentist, you know. So she took 4 and she sent me a message that, oh, the toothache stopped. So something works. Now, I showed you this one before. I have a video on that. All the hormone starts with cholesterol. So you see, cholesterol connected to arthritis, any pain, any joint pains. And go back to my husband. Why my husband suffered so long? It was 3 months. It was so painful. His triglyceride. See, back then I did not go study nutrition back then. You know, this is 40-some years ago. His triglyceride was 475. Average triglyceride for people is 100. His was 475. I didn't know anything better, and the doctor never mentioned. Because you know what? Triglyceride is not a heavy-duty subject to talk about. Because it can go up, it can go down. You exercise, it comes down very fast. One thing I can tell you, if you constantly have a lot of triglyceride very high, I told you the highest one I saw was 1,000. And I asked him, do you drink a lot of orange juice? He said, yes, breakfast. I tell you what, stop drinking orange juice because it's very acidic. Why? You eat orange, you know, you get a cup of orange juice like this, it probably requires about 7 oranges. You ask yourself, can you sit there, eat 7 oranges? No. If you eat 1 orange, you chew on it, the meat, the saliva alkaline neutralize some of the acidities in the orange juice. But if you drink the whole glass of juice like this in 5 minutes, the saliva is not enough to neutralize. So it ends up very acidic. One man, my professor said, one man went to Florida, that's where they grow oranges, and he was having holiday vacation. every day drink orange juice, it came back his triglyceride went up a couple hundred. So diet affects us, okay? So please, we have to know what we're eating. Bad oils everywhere. I'm not going to talk about it. There's a video on this. And you have sticky blood. You have sticky blood, please. That means no oxygen floating. Classic. Anybody in pain? I don't care what kind of pain in the head or pain in the joint. It's all because of blood fat. Now, I told you, this is a real case of my husband. This is it. I mean, back then I didn't know anything. I'm sharing with you. So 10 years already. That's why when I saw this product, I said, wow, people in pain will be a good thing because essential fatty acid cleans it out and brings oxygen. The blood can travel freely. So, you know, don't you all agree? Healing had to start with ourselves. This professor, I learned so much with him. He said, essential fatty acid attracts oxygen. That's it. And look at a copy from his book. Less arthritis, less joint pain swelling, faster healing. Same as Dr. Udo. Because he written this book like 30 years ago. These are science. These are nutrition science. It's not because I'm very successful. I come and try to make some money from you. No, 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 no. This is the only product in 30 years that I've seen. It is a powerful product. You cannot find cold-pressed essential fatty acid from whole seed anywhere. Go back to nature. Rain is very important for everyone. You know, yeah, we got men going up to the moon. We got all kinds of technology improvement. Despite all our accomplishments, we owe our existence to a 6 inches of layer topsoil. Nutrition. The soil, that's where everything grows. The fruits that we eat, the vegetables that we eat, and the cows are supposed to eat grass. All the grain grow from the soil. Yeah, the soil. The nutrition that we pick up from the fruits and vegetables, and you know, and everything comes from seeds. And also, and the fact that it rains. Trust me, you can sow all the seed you want on the soil. If there's no rain, that's what I do. So, you know, 10 years ago when I saw the company, I asked the owner, I said, what'd you name the company Rain? I said, very interesting. He said, yeah. He said, when I was small, after the rain, I see the hills all turn green. Rain brings life. So all I can tell you, I mean, it's 10 years now. I really have passion for this product sharing. And we need good nutrition, and they come from soil, okay? I love gardening too. So I'm back home now. I'm planting a lot of stuff. Yes, this is a powerful product. Cold press. Nutrition comes directly from the source, like Professor Pilskin said. And like I told you, in order for calcium to absorb into your bones, you need calcium, yes, and sodium, okay? And then you need protein. We have the complete essential amino, and we have the oil, essential fatty acid, all together in one little pouch. So you take it, how many times you take it, it's up to you. I told you already, I take 4 packets. I take every night 2 packets before I go to sleep. And I'm telling you, last year I tripped in my backyard. I thought I'll break my kneecap, but thank God nothing broken. This is it. Phytochemicals is the key ingredient in this pouch, because hundreds of chemicals working together in a synergy way. Why? because these are whole seed. We didn't extract them. We didn't extract them. We put it all together as a whole seed nutrition. And these chemicals will do wonders in your body. It provides all the healing, internal healing. Yeah, our product is documented, it's verified, confirmed by third-party testing. And it's stated inflammation 30%. There's a new product came out. I think Julia told me just in selling in shipped it to Singapore. That one's 80%. So remember that little magazine said anti-inflammatory diet curtails bone loss. You don't have bone loss, excessive bone loss, okay? You know, basic regeneration bone loss is necessary. The new, the old cells will die and the new bone cells will grow. That's automatic in our regeneration process. But for the regeneration, you need this nutrition. It's right here. Calcium, fat, and protein together. And this black cumin seed, I just want to make sure some new friends watching this. One of the key things that they've done research on this, like I say, there's about 1,000 scientific reports, research published on black cumin seed. And black cumin seed is one of the ingredients here. Natural antioxidant, anti-inflammatory, and pain-killing effect. Some people get a car accident, we tell them to take together. And I heard this one old lady, I mean, the sons and daughter told us, 90-year-old fell down on the motorcycle, broken 4 ribs. She didn't go to hospital. They just gave her 4 packets a day. Nutrition, just take it. Your body will do the healing. Okay, I'm not making this is not drugs, not medicine. This is food. Nutrition will feed ourselves. Now, 281 times stronger for reducing inflammation than aspirin. This research was done by a professor in University of Maryland, Dr. Lucy Yu. I know she's one of our doctor advisory board member. Maybe one day she will come and speak. So this is it. Now, again, in closing, I just let you know, good oil in, bad oil out. So it makes especially strong bones inside the bone marrow. It requires lots of good oil. So besides cleaning out the bad oil that we eat every day, it will have enough good oil to help our regeneration process internally. And this doctor always do this text, live blood test. I took these pictures, and when the blood is all sticky, no oxygen, so sticky blood not going to allow oxygen to heal that wounded joint or that inflamed tissues around the joints, okay? And I know a lot of people have these pains in the morning when they wake up. Why? Because the hands are the farthest away from the heart. So when there's the blood pumping, sticky, not enough blood flow go down to the hand. So that's how it is. The tissues, just like I told you, my husband, he has triglyceride 475. Jam up. How can the blood cell bring oxygen to go to heal up the wound? No, it just slows down the whole process. Now, this doctor would give the person 2 packets of salt or corn. You got salt, one corn, same thing. You take it together, 25 minutes later, the doctor will do another blood test. You see the oxygen's already starting. So you wait an hour, I'm pretty sure, you move around, these bloods will be very good. Now, I have something to show you because I thought that was amazing. Now, I told you already, when the blood goes into the finger, it's pretty hard. I bumped into her in Hong Kong office, and she thanked me. It was the first time I met her. She thanked me for bringing the ring soul to Hong Kong. Then she showed me her finger, pinky. You see, this is the new picture. Very nice looking pinky, right? The joint's fine. Then she showed me the mobile phone. You see the mobile phone? This little round thing like the size of a soybean. It was calcified stuff that grow on her thing, hard, like soybean. So I asked her how long you had. When she told me, she said, "Oh, my fingers all fine now, no pain, nothing now." I said, "Will you have a picture from the old days?" So that's how she showed me. You see, I just couldn't imagine. This thing can go to the finger and remove these calcified deposits. It's called calcification. She said it was hard. It's not the soft, fatty tissues. No, this is hard, calcified. So I'm telling you, calcification happens to everything. I think one time I talked about the heart. That's what it causes heart attack. Calcification. This is it. So I'm telling you, this is it. Okay, I have to end my talk, and I hope everyone learned something, right? So stay healthy, strong bones. Thank you. See you next time. Bye-bye.